Welcome back as we pass the 1-year mark on the pandemic and see a hopeful light at the end of the tunnel with the vaccination. We can review how we've responded and what remains to be done in creating healthier communities. And joining me is Pedro Khan, who is telling us about serving the communities in a very healthcare needs. And I want you to pronounce the name because I am not good at pronouncing names.
So I'm the CEO of Adelante Healthcare.
Adelante.
Yes.
Did I say it right?
Yes.
Adelante.
Yes.
This is great. And in reading about this, of course, company, program, it's amazing. I want to make sure I say everything right, is that you serve the community that a lot of people don't realize, the farmers, our minority community,
Yes.
With health needs. And let's talk a little about that.
So yes, we serve the underserved and many more. We were founded in 1979, working with a small group of farm workers out in Surprise, taking care of their primary care needs and all the other needs that they may have had during that time, and have grown immensely as a company to now serving over 80,000 unique patients, with 9 comprehensive health sites. Truly fascinating work and the growth that this organization has had.
Yeah, I love that you went to the community that a lot of us forget, not forget, I guess we don't realize do need health care, and they're very big and central to Arizona, because those are our farmers out there that are working hard to make sure we have fresh food and everything.
Oh yeah, and they're definitely essential workers, and we're doing our best to organize our group to go out and give the vaccinations in the far West Valley, the farms that people forget about in Aguila, and we are also in Wickenburg, and so we're really providing a huge need out in the Wickenburg community.
Okay, you said right there giving the vaccine to rural areas, that I think we always think, okay, we're getting the vaccine over at the Glendale Stadium and
Yes.
different areas around here, but not in the rural area. So if someone's out in the rural area watching right now, how do they go about, on course, getting the vaccine out that way?
So we are going out to many of the rural area parts. Currently we've been out in Wickenburg and providing vaccines on the weekends. We have a date coming up here soon to go out to Gila Bend, and we're looking forward to serving that community. We are one of the only healthcare facilities out there in Gila Bend. We're actually working with, you've been seeing on the news, the migrant farm workers that are stuck over there right now and looking for housing. We will be providing their testing for COVID-19 to come out here for housing in Phoenix.
That's so amazing, because again, this is how we get a hold of this pandemic, how we get a hold of COVID-19, by taking care of those out in the rural community, because they do travel in. And if they're not vaccinated or taken care of, it can spread a little bit more, and that's what you guys are making
sure. No, absolutely. We're also very fortunate to get the allotment from the CDC directly, and so we're one of the 250 federally qualified health centers across the country that received this access. And so just recently we received 4,700 doses, and 2,700 of those were Johnson & Johnson. And the reason why I say that is because it's definitely a need for our communities that can't, our BIPOC communities, individuals that are not able to come back for that second dose. Yeah. It becomes important. The efficacy is still high enough that we are leading towards that herd immunity, and we're just trying to do our part. Like you said, those big pods that are out there, our staff are volunteering at those pods as well. But there's a lot of work definitely to be done.
Yeah, there is, and also even after we get a hold of this, and that's where you guys come in, because it's not just about the vaccine. You take care of all the different health needs out there.
Oh, absolutely. We have pediatric care, women's health, family medicine, internal medicine, dental care, as well as behavioral health. I like to brag that, people don't realize that we're one of the best kept secrets in town when it comes to a federally qualified health center. This past year alone, we delivered over 1,200 babies, in our hospital settings around here, and with our practitioners. We have seen over nearly 500,000 individuals last year with our WIC services, women, infant, and children, all of our comprehensive care. It's really a fascinating place to be, and especially during this pandemic. We've had a pivot to telemedicine, which was a change, a change of scope for us, but
yeah.
Definitely moving through that as well.
Wow, and that is so where we're seeing the cutting edge of technology being used.
Yes.
With your company, as you said, the telemedicine, because that means someone has to go way out into the rural area with Zoom, whatever, and start working with all of them, which is amazing.
Or even with folks in town, right? During this time, people have been isolated and not, coming into facilities as often as they probably would have. So we saw much of that as well, and we had to pivot to telemedicine, teleconferencing as well, and it definitely will be a part of our business, for the near future. And but we're excited about some new other technologies, and that's doing remote monitoring. And how do we monitor hypertension? How do we monitor diabetes when somebody's not able to come into the clinic?
Yeah, amazing. I'm so glad you came in. I'm learning so much.
Happy to be here.
Tell people how they can find out more.
Oh, so you can come to adelantehealthcare.com to visit any of our sites and access our services, and we'd be happy, especially during this time. It's such a need to go back and get into the facilities. We serve everyone within our communities, so it doesn't matter if you're on Access, if you have commercial insurance, or on the marketplace. We are here to serve you.
Pedro, thank you very much for coming in. Thanks for teaching us about this new, well, not new, but for being here.
Yes. Thank you.